Hi, I'm Abe Outsoren, and I'm a professor in the School of Nursing at Western University, and I'm one of the bloggers on the Research Matters blog at the Homeless Hub. I hope you've had an opportunity to read some of my other posts. Always happy to hear folks have some feedback on these, or if there's any particular areas of research that you want me to help unpack. Today I wanted to do something a little bit different. I wanted to talk about a specific issue that's relevant at the time of COVID-19, which I don't think has got as much press as some of the other actions that are being taken and issues that are being addressed around homelessness at this time. And that's the issue of safe supply. And so safe supply is essentially a response to people who have a substance use disorder, and involves prescribing a known dose of a particular substance to folks as a way of reducing the harms of their addiction. And so the idea of a safe supply actually goes back and is very well established in the research. Some of the original ideas are out of the UK, for example, with prescription of heroin going back about 40, 50 years now. And there's all sorts of models for safe supply, and that might be something like a managed alcohol program. So this is a form of safe supply where the alcohol is prescribed, it's a specific dose that's provided, and again, it's to reduce the harms of people's substance use. More recently in Canada, with the overdose crisis, we've been talking about safe supply as a way of dealing with, particularly with opioid-related substance use. So there's sort of multiple streams of harm reduction that are happening simultaneously right now. And so we've seen the overdose prevention sites as a well-established, again, a research evidence-based response to substance use as a way of both kind of reducing the harms, but also in a lot of cases ending up streaming folks into some sort of treatment or support services. But that, of course, is just one way to respond to people's substance use. And another is to think about what are the broader societal impacts of people who are acquiring substances through illegal means, as well as how do we reduce the risk of a tainted supply and reduce the risk of unintentional overdoses or other harms such as infections that come when folks are purchasing their substances or manufacturing their own substances. And so a safe supply basically is a harm reduction approach. So it accepts the principles of harm reduction that folks will have to go on the recovery journey at a speed and pace that's their own. We have to follow folks' lead, we have to be respectful, and we have to base our care and relationship. And so prescription of substances to deal with a substance use disorder is a way of doing that, of acknowledging that we can't force people to stop using substances, and that there are harms related to some patterns of substance use. So why am I bringing this issue up right now at the time of the coronavirus pandemic? And that's because we are seeing some of the impacts in the population of people experiencing homelessness and those who are street involved and use substances related to their substance use. And so some of the challenges that we're seeing, for example, is the reduction of access to people's traditional supply routes. And so, for example, with the closing of the borders, there's been changes in the patterns of movement of drugs. And so that's meant that sometimes people are going away from their trusted source, their trusted dealer, to again purchase substances somewhere else or to manufacture things themselves. And in just some anecdotal stats, I've seen a couple cities who have posted on Twitter, for example, about increases of the numbers of overdose. So communities that have been tracking overdose rates. Now, I'm not saying this is across the board because we don't have enough data yet to say for sure, but there are some communities where the number of overdose has gone up. And so there is one quick response that we've seen that I think is a good model for us to look at, which was how folks who are on methadone maintenance treatment were supported. And so that treatment often requires folks to have a daily prescription, depending where they're at in their journey of that treatment. And many physicians adjusted that treatment to, for example, giving folks 5-day or 7-day carries of their medication. And so that they didn't have to get as many appointments. And so I just bring that one up as an example of how we can flex our support services around substances due to the change right now with the pandemic. And so how does this kind of all come about in terms of safe supply? I was reflecting on in my community, I'm in London, Ontario, there's been a lot of concerns about break-and enters that are happening. So with businesses closed and everyone home at their house, there's been a reduction in break-and enters in residential properties and increase in commercial properties. And so we've seen calls for things like increased policing, increased security cameras, that sort of thing, which we know won't work. We know that it's impossible to get enough eyes on the street from police that would ever prevent these types of commercial break-ins. And so instead, I was reflecting on, well, how do we address the core issue, right? How do we address issues of poverty and issues of poverty related to substance use? So apart from issues of poverty and discussions for another day, such as basic income and increased social assistance, in terms of poverty related to substance use, what we can do is we can provide people with their substance. And so if folks are receiving a substance through a prescription, then they're not being forced to find funds to acquire that substance themselves. Safe supply also, of course, reduces overdose. And so folks know exactly what they're taking. It's much easier for folks to independently manage a safe dosage of their substance. If it's labeled on the bottle exactly how much they're getting. And so also reduces the risk of infection. So if it's a substance that's been manufactured through our pharmaceutical supply, then we know that the substances aren't being tainted with bacteria along the way. So this has many positive outcomes in the time of the pandemic. It reduces the load on our healthcare system from infections and from death. Obviously, it's better for the users in a lot of ways. It protects people from the negative impacts in their own lives of crime. For example, decreasing the need for women to do sex work to acquire funds for their substance. And also it simply reduces the criminal element in this community as a whole. And so it does the same as we've seen with the legalization of marijuana, for example, is that it puts some portion of those black market businesses out of business. So I think safe supply is a really promising practice, at all times, but particularly in a pandemic when our health services are so stretched, when those who are already vulnerable become that much more vulnerable. And it's simply a way to shift something that is both a health and social challenge and really shift it into something that is managed, it's controlled, it's supported, and it's done in a way that's safer for our community as a whole, for people who use substances, for our services that support them. So I hope wherever you're at in the country or around the world, as you are doing whatever you're doing to address the impact of the pandemic on people experiencing homelessness, I hope that you're thinking about safe supply as one of the conversations that you can have in your community as a way to make sure that people are as healthy and safe as possible at this time. So thanks, and I hope you take the opportunity to follow and read any of the other research blogs from this week.